This week's Medicine of the Week is a drug class called NK1 receptor antagonists. NK1 receptor antagonists belong to the class of neurokinin receptor antagonists, specifically targeting the neurokinin 1 receptor. They are widely used as strong antiemetic agents. Commonly used examples are aprepitant, fosaprepitant, and netopitant. Let's start with the mechanism of action. NK1 receptor antagonists block the binding of substance P to NK1 receptors in the area postrema, nucleus tractus solitarius, and visceral afferent nerves, and thereby inhibiting its effects. Substance P is a neuropeptide that plays a key role in triggering nausea and vomiting in response to chemotherapy. Therefore, when blocking NK1 receptors, powerful antiemetic effect is achieved. Substance P is also involved in various physiological processes, including pain transmission, inflammation, and mood regulation. Therefore, NK1 receptor antagonists have also anxiolytic and antidepressant effects, and there are ongoing clinical trials for potential use in conditions such as psychiatric disorders or opioid and alcohol dependence. NK1 receptor blockers are typically used in the management of chemotherapy-induced nausea and vomiting, abbreviated as CINV. They are very effective in preventing delayed CINV in patients receiving highly or moderately emetogenic chemotherapy. These agents are primarily used in combination with other antiemetics agents, such as cetrans and dexamethasone, to provide more effective control of CINV. Further information about the dosing or combinations in specific cases can be found in ESMO guidelines. Let's talk about pharmacokinetics. NK1 receptor antagonists are typically administered orally or intravenously. The oral bioavailability of aprepitant is approximately 65%, and it is 95% bound to plasma proteins. It is well distributed throughout the body and crosses the blood-brain barrier. Aprepitant and netopitant are primarily metabolized by the liver via cytochrome P450 enzymes, notably cytochrome 3A4, with minor contributions from cytochrome 1A2 and 2C19. The biological half-life of aprepitant falls within the range of 9 to 13 hours. It is mainly eliminated through feces and to a lesser extent through urine. Caution is needed in patients with hepatic impairment. Fosaprepitant is a water-soluble prodrug of aprepitant designed for intravenous administration. It is converted within 30 minutes to aprepitant after infusion into the body. Fosaprepitant is available only as an intravenous injection, aprepitant in oral capsules, and in some countries also as an intravenous formulation. Netopitant is available only as an oral formulation in combination with palonosetron. When taking NK1 receptor blockers, patients may experience also some side effects. Most common are fatigue, dizziness, constipation, headache, or dyspepsia. Aprepitant and fosaprepitant may also cause hiccups. Although these agents are generally well tolerated, some cases of serious adverse reactions, including Stevens-Johnson syndrome, rash, and neutropenia, have been reported too. In addition to side effects, it is good to remember potential drug interactions of aprepitant and netopitant. They are metabolized via cytochrome 3A4, and therefore inhibitors and inducers of this enzyme may affect their plasma concentrations. Furthermore, aprepitant is also a moderate cytochrome 3A4 inhibitor and cytochrome 2C9 inducer. Therefore, when combined with dexamethasone, the dose of dexamethasone should be decreased to 50%. Caution is also needed in case of co-administered chemotherapeutics metabolized by cytochrome 3A4, for example etoposide or ifosfamide. Aprepitant, as an inhibitor, may increase the toxicity of these agents. Aprepitant also reduces the effectiveness of hormonal contraception. Decrease in plasma concentrations of estrogen and gestagenes may occur up to 28 days after discontinuation of aprepitant. In summary, NK1 receptor antagonists are valuable drugs for preventing chemotherapy-induced nausea and vomiting by blocking the action of substance P on neurokinin 1 receptors. They are typically used in combination with cetrons or dexamethasone in patients receiving highly or moderately emetogenic chemotherapy. NK1 receptor blockers are available in oral but also in intravenous formulations and are generally well tolerated. Thank you for watching. For more information, consult your medical textbooks or reliable sources.